Everyone, thank you so much for joining us right here on News Channel 5+. You're watching Medical Monday. Joining me tonight, Dr. Pat Whitworth, and we are really diving into a lot tonight, dealing with just the advancements in breast cancer treatment, and also some of the new devices that have come out, and you know, just really answering some great questions from our wonderful viewers. We do love to hear from you, and of course, Doctor, happy to answer those questions as well. Thanks so much for being here tonight.
Thank you.
You know, some topics that we want to get into. We were kind of going into just some of the basic questions. What is breast cancer? Who typically is diagnosed? And, you know, what can we do? And I kind of want to continue with that topic. Now, what are some of the symptoms of breast cancer? Of course, early detection is so key and vital, but as a doctor and folks tuning in tonight, maybe what are some symptoms we can keep an eye out for?
There's a whole list of symptoms that we say, okay, this is a red flag, we have to check it out. Most of the time, those symptoms are not really breast cancer. Some of the time they are, so we have to look into them. But I see patients every day who are really terrified. Maybe they have some nipple discharge, or maybe they've found a lump, or they have a pain that's really sharp in one spot. And those are the things we have to check out. They almost always are benign and nothing bad, but it's one of those things where we have to check. So we're never disappointed if it's, you know, women say, well, I'm so sorry, I should apologize, it wasn't anything. We say, no, this is good, you did the right thing, you should check it out. But those are the main things. A dramatic change in the breast, a lump that doesn't really go away and it doesn't really go with a woman's cycle. Any kind of a change of appearance where you see some indentation or dimpling. Now, these are not things that are cancer. These are things we just check when that happens.
You know, what are some of the types of breast cancer? I mean, it really does vary. There are different stages, and just kind of touching base on that as well.
This is an area where we have made absolutely fantastic progress. In the past, we sort of looked at, well, how big is it? And is it in the lymph nodes, and we would stage it. And so people ask that all the time, what's my stage? But we now know that there are some very important types, and the real importance is it relates to what kind of treatment works for that type. In fact, it's, you know, the analogy would be, you know, you get an infection, if you're going to take an antibiotic, you want to make sure it's one that works for that type of infection. It's not resistant. So most breast cancers are hormone dependent. Most breast cancers we can attack with either a hormone blocking agent or something like that. That's more often in the most commonly affected group, which is women in their 50s and 60s and maybe 70s. Women who are younger or women who have one of those gene abnormalities can often have a breast cancer that is not in that most common hormone dependent group that's sometimes called triple negative. It's estrogen receptor negative and progesterone receptor negative. That's two of the triple. The other thing is something we call HER2, and this was one of the biggest breakthroughs in breast cancer treatment. In fact, most people would consider it one of the biggest breakthroughs in the last 2 decades. And with HER2 positive cancers, there are extra copies of a gene that makes a growth factor receptor. You know, a growth factor receptor is sort of like the switch that the key fits in. And those growth factor receptors sit on the surface of the cells. And if something triggers them, that makes that cell begin to divide. You know, we talked about regulating that growth. Well, some HER2 positive cancers have way overmade those receptors. There are extra copies of that gene. You have too many of those receptors. Not only that, they are switched in the on position. So those cells are really growing. And so what happened was, first a drug called trastuzumab or Herceptin was developed. It's an antibody. It's not really chemotherapy. In general, chemotherapy just, you know, harms any cell that's dividing rapidly. Herceptin is a silver bullet that goes straight to those HER2 receptors. There's another new drug called pertuzumab that does the same thing. So for those women who have a HER2 positive breast cancer, we now, instead of, in the past, we'd say, wow, that's an aggressive cancer, we're really concerned, what are we going to do? Now we say, oh good, you have the HER2 positive cancer. You know, we commonly combine those silver bullets with conventional chemotherapy, but your chance of cure is superb. It is excellent instead of being scary like it was in the past. So we sort of have these big groups, either triple negative or HER2 positive or hormone dependent. And so once we classify those and do some very fancy what we call genomic testing to confirm that, we have a much better idea of what treatment that patient needs.
It's just incredible, the advancements that have been made and then just continue. Every year, are you seeing just something change, and is it that rapid?
It is. In fact, doctors, it's hard to keep up. There is literally an avalanche of information coming out all the time, and so that's why I'm very spoiled, because I narrowed my practice down just to breast care. I'm a cancer surgeon, a surgical oncologist, but I just do breast care, and that makes it easier for me, but it is still an avalanche of new stuff.
Let's go ahead and talk about your practice with you being here tonight. Tell folks a little bit of information or any sort of, even stories that you want to share this evening.
Well, we see a lot of women who have just had an abnormal mammogram and they're scared to death, and or found a lump, that sort of thing. We do a lot of the diagnostic biopsies. We work with some of the radiologists in the hospital as well. And so most of those women, we end up getting to give good news. And that's kind of a happy part. You know, you have somebody who's very scared and you get to say, guess what? It's nothing bad.
What
so
a
that
relief.
happens, yes.
Yes.
In fact, if a woman has a mammogram that says you need a biopsy, only 1 in 5 of those is cancer.
Wow, that's a great statistic.
It is, it really is. 4 out of 5 are not. But if we try to get better at, not doing biopsies, we start to miss some things. So we have that kind of low bar of a 20% risk overall. So if a woman is diagnosed with cancer, the good news is that the vast majority of those are cured. And I've got to confess, I use the news as a little bit of an example. I tell women, when you watch the news, they don't show you in Nashville 200,000 women just drove home safely yesterday. They show you the car wrecks. And so you will hear the scariest stories. But we expect to cure this, and most of the time we are right. We'd win a lot of money betting that person's going to be fine.
You're on to us. He's on to us. Oh no. That is a great analogy, though. I mean, we're not going to cover the 90%, the normal, that's a great analogy and very, very true. And it's wonderful to hear, there is most of the time delivering that good news. And, I think too, a lot of women, it's scary to make that appointment and, just to stress that you do need to go seek, that treatment. You need to get that answer. And if you do feel like you maybe have something that is abnormal, you need to go see a doctor like Dr. Whitworth. And let's talk about how folks can get a hold of you, where your center is located, and just some other ways to kind of, if you feel like maybe you do need to seek some,
Well, we're part of a large group of doctors called Advanced Health. And Advanced Health has specialists in all areas. It's a great group. Our practice is called Nashville Breast Center. And NBC, it's kind of easy to find. People call us on the phone.
Another news analogy.
People call us on the phone sometimes and say, I'm looking for the National Breast Center, and we don't correct them. We say, okay, you found it, come on in. But we're pretty easy to find, I think.
But let's talk about the location in Nashville. I mean, you probably could have practiced anywhere. Why Nashville?
Oh, well, having grown up in East Tennessee and trained for 3 years in subspecialty training in Houston, Tennessee was a natural place, and of course Nashville had such an academic environment. I first looked at work at Vanderbilt. I met some doctors who had a very exciting practice in the St. Thomas and Centennial area, and that's where I started out, 1991. My office is in the medical office building next to St. Thomas Midtown now.
Great location as well. And of course, I believe, yes, we do have, real quick, I want to go ahead and give folks the Advanced Health referral line. That's 615-986-6033. There's the information there on your screen. Of course, email appointment requests to medicalmondays@ouradvancedhealth.com. Be happy to hear from you. And again, there's that referral line there on the screen. Or you can also visit the website advancedhealthmedicalmondays.com. We're going to go ahead and pause for another quick break, but we'll be right back after this here on Medical Monday.